Hello and welcome. Federal government confirms 20 new cases of COVID-19 and the second death from the disease in Nigeria, bringing the total number of confirmed cases in the country to 131. Oyo State Governor Seyi Makinde tests positive for COVID-19, says he's asymptomatic but remains in self-isolation. 5 additional COVID-19 patients discharged from the infectious disease hospital in Lagos after recovering from the infection. And authorities in Spain say the COVID-19 outbreak in the country is slowing after recording lowest number of new confirmed cases for a week. Plus, we'll have business, sports, news from Abuja, the FCT, and later on international news from our studios in London.
On business news tonight, banks in Lagos, Abuja and Ogun State to maintain minimal operations during the 14-day restriction period declared by President Muhammadu Buhari.
On sports news tonight, rescheduled Tokyo Olympic Games to start on July the 23rd, 2021 after being postponed due to the coronavirus pandemic.
And from Abuja, lawmakers in the Senate to contribute 50% of their salaries to the efforts to contain the spread and treatment of coronavirus in Nigeria. The dreaded COVID-19 is still raging around the world, and Nigeria is not an exception, as everyone is on red alert, cautiously following precautions by health officials and, of course, waiting patiently for a cure. Sadly, the Nigeria Center for Disease Control has announced 20 new cases in the country today, bringing the total of confirmed cases to 131. The NCDC says of the 20 new cases, 13 are in Lagos, 4 in the nation's capital, Abuja, 2 in Kaduna, and 1 in Oyo State. The country has also recorded 2 deaths from the virus. A state-by-state breakdown of the record shows that Lagos has 81, the FCT 25, Ogun 3, Enugu 2, Ekiti 1, Oyo 8, Edo 2, Bauchi 2, Osun 2, Rivers 1, Benue 1, and Kaduna 3. Now, apart from those latest figures, the country also made new records. First, a second death was announced by the federal government, and it says the patient had underlying illnesses. Then, Governor Seyi Makinde of Oyo State announced he's tested positive to the virus and he's to remain in self-isolation. But it's not all sad news, as 5 COVID-19 patients who have been undergoing treatment at the Lagos Isolation Center are discharged after testing negative. And the preparations are on for the lockdown in Lagos and the nation's capital, Abuja, in compliance with the directive of the president. With those highlights, we kick off with the federal government's confirmation of the second fatality from the novel coronavirus in Nigeria today.
The principles of care, really, for COVID-19 is to maintain respiratory function as the body recovers. Now, you would have seen and noticed that most of our cases so far have been mild to moderate. We've been fairly lucky not to have had too many severe cases. We unfortunately have had 1 fatality. Our target is to get out results in 12 hours. We're not there yet for every result. We get many of them out in 12 hours, but we're not there yet because what we can do is sometimes there's a positive, it's borderline, we make a decision to repeat. So we have released a new case definition yesterday, defining exactly who needs to be tested. We will apply this strictly so that as long as we don't have the number of tests that we need, which is the reality at the moment, we're working very hard to increase that. But as long as we have these limitations, we have to focus on those who need it the most. At the same time, work very hard to increase the capacity of our testing, which is what we're doing day and night, and we're really assuring Nigerians through different pathways. There are new test technologies that have just been approved. We've already started the procurement process for that. They should be in the country in the next couple of weeks. So that will then that will really radically increase the throughput that we can have for testing. We're following over 6,000 contacts of these 111 confirmed cases across these two cities. Every time we have a new case, we add about 50 to 60 contacts that we then have to follow every single day for 14 days. If we can't do this, if we don't have access to these cases. So this is really one of the reasons, just one of the reasons why Mr. President took this very difficult decision. And it's not just to stop movement. It is to enable us and our teams, the Lagos State team, FCT team, reach the contacts, keep them at home, make sure they're supported, and see whether we can really use this time to buy some time to get ahead of the cases.
Now, a few moments ago, the NCDC announced 20 new cases. Let's just take a break now and show you what we know about those cases.
It's the first press briefing by the Presidential Task Force on COVID-19 in Abuja since it was inaugurated by President Muhammadu Buhari on March 17 this year.
Chairman of the Presidential Task Force.
Secretary to the Government of the Federation, who is also the chairman of the task force, highlights the government's economic sustainability plans.
Mr. President has today approved the constitution of an Economic Sustainability Committee to be chaired by His Excellency, the Vice President. Similarly, you must have heard that Mr. President has also approved the exemption of the financial services sector from restrictions to allow skeletal operations in the financial system and the money market in order to keep the system in light operations during this period.
Next is the Minister of Health, who gives updates about the current status of confirmed cases and how the government is managing the spread of the virus.
Till date, 3 persons have been discharged after successful treatment, but sadly, another fatality was recorded over the weekend in the person of a patient who had severe underlying illnesses. We have intensified contact tracing, and our strategy remains to promptly detect cases, isolate them, and follow up with their contacts.
The minister also highlights what the government is doing to scale up testing and treatment capacity.
The NCDC has expanded its capacity by engaging hundreds of ad hoc staff to support various areas of response, including the call centers, contact tracing, and follow-up of persons of interest. On the order of His Excellency the President, all retired but essential and able-bodied staff are to be recalled to service at this crucial period. In addition, training is being conducted for medical personnel to support overall preparedness and response activities to prevent the virus from spreading further into other states.
How exactly is the government
fielding answers to questions from Channel's reporter on how the government intends to cushion the effects of the total lockdown on citizens? The Minister of Humanitarian Affairs has this to say.
Let me also reiterate here that because of this COVID-19, the vulnerable groups have to be expanded because we are aware that we have people who live on daily wage. And so we're also going to look at those groups of people to see how we can take this food relief intervention to them in these affected areas.
There are currently over 100 cases of COVID-19 across 12 states in Nigeria, with majority of the cases in Lagos and Abuja, just as states across the country enforce a lockdown to prevent further spread of the virus to other parts of the country.
There's a new addition to the list of prominent Nigerians who've tested positive for the coronavirus. The latest addition is the Oyo State Governor, Seyi Makinde, who announced a while ago that he has tested positive for the virus. The governor made the confirmation via his Twitter handle today, stating that he is asymptomatic and he'll continue to self-isolate. Governor Makinde also asked residents of the state to comply with the directives aimed at curbing the coronavirus in the state, while the former Chief Medical Director of the University College Ibadan, Professor Temitokbe Alunge, will take over as the head of the Oyo State COVID-19 Task Force. Mr. Sheyi Makinde is the third governor to have tested positive for the disease after Bala Mohammed and Nasir El-Rufai of Bauchi and Kaduna states, respectively. The Nigeria Center for Disease Control had earlier announced 4 new confirmed cases in Oyo, and that was before we updated you on the figure. 5 more patients who have recovered from the coronavirus have been discharged from the Infectious Disease Center in Yaba, Lagos today. The state governor, Mr. Babajide Sanwo-Olu, announced this in a tweet, saying, "We've just discharged 5 formerly positive #COVID-19 patients from our infectious disease hospital after treatment and multiple testing by our specialists. Congratulations to the healthcare team and the patients." The governor adds that the preservation of life is very important to the state government, and the lockdown, which will begin tonight, will help authorities trace and stop the spread of the virus. Governor Sanwo-Olu adds that the state government has increased capacity at all levels as he gives Lagosians the assurance that no matter what happens in the days ahead, we can all beat the disease. From Lagos, we move over to Ogun State, where the lockdown ordered by the president will not commence until Friday, April the 3rd, when the state government would have been fully prepared and make available the needed palliatives. The state governor, Dakwa Abiodun, mentioned this today during the launch of a 129-bed isolation center in the Ikenne area of the state. Governor Abiodun says the state is providing about 300 bed spaces and ventilators for the isolation centers. Ogun State has recorded 3 confirmed cases of COVID-19.
With 3 cases recorded in the state and its proximity to Lagos, Oyo, Ondo, and the Republic of Benin, the government of Ogun State is indeed not taking things for granted in its response to the COVID-19 pandemic.
In total, we have over 300 beds for isolation and treatment, meaning that if you add the 128 we have here, the 21 we have in Shagamu, the 100 we have in Berekodo, and the 70 the isolation, we have over 300 as of today. I'm not sure that there's any higher level of preparedness in any other state that has been organized, arranged, and successfully deployed in this short period of time through self-help in this country.
While seeking the cooperation and understanding of the people, he speaks about the lockdown.
After consultation with the presidency, the interstate and international borders will be closed tonight at 11 p.m. as directed by Mr. President. However, the total lockdown of the state will be effective from 11 p.m. on Friday, 3rd of April 2020. And let me explain that. I've been in consultation with the presidency, and I have requested that they graciously allow us in Ogun State to prepare for this lockdown in terms of ensuring that we have enough food banks across the 3 central districts, so that when eventually there's a lockdown, our people will have enough food supply during the lockdown, and they graciously accepted.
The World Health Organization and the Nigerian Center for Disease Control were also part of the event, and they gave the state government thumbs up for its quick response and political will to contain the pandemic.
I remember 2 days ago we came to this facility. Initially it was supposed to be for 160 beds, and we said no, that you have to ensure that adequate distance between the beds. And you listen, and also made some structural adjustment which has to be done. And they were all effected immediately.
I want to congratulate Ogun State because it is now on record that you are able to do the needful within a short time to respond to the intent of health emergency.
While the government is putting the facilities in place, it also reminded residents across the state of the need to observe basic personal hygiene as well as social distancing, among other measures.